You know, communication is not only talking to and speaking with someone, it's making sure that we've explained it in a way that people understand and that they have the opportunity to ask questions. And AIDET is a very valuable tool in patient communication that helps decrease patients' anxiety, increase their compliance with our plan of care, increase the understanding of what's happening with them, and it improves their overall patient experience, and they'll remember us favorably when it comes time to complete a survey. And we want them to have a good experience. So what does AIDET stand for? The A stands for acknowledge, greeting the person, calling them by name when you come into the room after you've knocked on the door, introducing yourself and who you are and what's your role, explaining the duration of how much time you're going to take while you're visiting. And you may not know, I'm going to be here 5 minutes, but say I'd like to take a few minutes of your time. Explain what's going to happen while you're here and what they can look forward to. And then thank them for allowing you to treat them and for choosing our organization for their health care. Because let's face it, they can go to another facility for their care, and we want them to choose us and to want to come back if they need further health care, and also to market us to the community. Another thing is the teach back method. You can ask that question, please explain to me what I told you so I can make sure I didn't miss anything. So that's not putting down the person saying that you didn't understand. It's seeking knowledge that do they understand, because we want them to participate in the health care. And one way to do that is not to talk down to them, but to speak at a third grade level, because the language, every business has a language that's unique to them, but it's not unique to that patient, and we want to make sure that they understand the terminology that we're using. It also, when they're trying to teach back, may spur a question that they didn't think to ask when we were talking about what that was. And managing up the team, it doesn't just promote the team and give the patient confidence in the healthcare team, but it promotes yourself as well as part of that healthcare team. And we want this patient and this family to see the healthcare team in a positive way and have confidence in them, because there's a new face coming in every time: dietary, respiratory, a physician, a consultant, their advanced practice person, the new nurse coming on. It's important that they have confidence in the people that are coming in the room. All of these things are best practice recommendations from numerous places that have been tested, and if you look these up on the internet, you will find them, but we're going to put them in one tidy little place for you to have references as to what they are. Along with the attachments, we're also going to provide a pre-assessment so you can say, okay, which ones of these skills am I using and which ones need a little bit of work. And after the education, doing your pre-assessment and studying these things, we have a post-test that'll say, this is what I've learned, and then it tells you also where your weaknesses are and what you also might still need to focus on. And then there's an opportunity for people, either your CPN or your PX champion at your facilities, to do ghost rounding or shadow rounding to see how effective we've rolled out these tools. We also have some best practice recommendations, and one of them is that I did not do in this taping was I did not ask if it was okay to speak to the visitor that was in the room or ask them to leave, and that was a shortage on my part. But we want to remember patients' confidentiality when we're speaking to patients. You can also set up a sim lab so that you can practice these things away from the patient until they become hardwired at your facility and it becomes a normal part of your routine. You can also use the patient's phone when you're in the room to call family members so that we can keep family members informed if there doesn't happen to be one at the bedside. And you can answer those questions that they may have about the plan of care and what's going to happen and the anticipated discharge while you're there with the patient, and that involves everybody in the healthcare. Commit to sit, puts you at an eye level with your patient. It makes it more that you're on the same level. We're both equal in this relationship and this partnership for your health care. We're just playing different roles. Remember to thank them and remind them about the survey. Managing up the team is so powerful. Use the whiteboard, as I said, for a key form of communication. And if you have more than one team, have a PX champion on each team. Don't just have one that is responsible for teams that don't normally work together. And don't hesitate to promote people who are getting good scores or who are mentioned in surveys, because we want this to be a positive experience, and for staff to really know where they are in the survey, provide, whether it's a doctor, whether it's somebody in dietary, somebody in housekeeping. These standards are the same regardless of who's coming into the room. If you have any questions, don't hesitate to reach out. The information will be attached to the PowerPoint, and we look forward to everybody having improved patient satisfaction scores as a result of these initiatives. Thank you.